welcome today to our webinar on supporting workers through occupational therapy. My name is Leah. I'm an occupational therapist with Community Therapists.
I'm Brittany. I'm also an OT that works at Community Therapists. Thanks for that intro as well. Here, just click that one there. Great. So today the objectives that we're going to cover are to understand what OT is and the benefit OT has on employees and employers in facilitating return to work. Second, through a case study, we're going to understand the role of OT, employers, and stakeholders in achieving a durable return to work. And lastly, understanding how and when to access OT services.
So what we do as OTs help workers get back to activities that are meaningful and necessary. As OTs, we view activities in three different categories. We look at them in terms of self-care, productivity, and leisure. We see life as a balance between these three areas, so we target our interventions accordingly. Self-care is getting in and out of bed, grooming, showering, your basic activities of daily living. Productivity, so going to work, of course, but it could also include volunteer work, gardening, childcare, and then leisure, your hobbies, for example.
Right, so to introduce a case study here, we're going to follow Janice, who is a 42-year-old healthcare assistant at a residential care home. She sustained a right shoulder and low back injury when carrying a resident out of a room which was on fire. So in this situation, the worker acted quickly to ensure the safety of the resident, and the physical act of carrying this resident out of the room which was on fire resulted in tremendous strain to her right shoulder and low back. Also an important note, in this particular situation, the cause of the fire in the resident's room was actually a fan that had short-circuited. So after this incident occurred, the client visited her doctor and a WorkSafe claim was made. Once the claim was accepted, the WorkSafe case manager referred the client for physiotherapy to address those physical injuries. However, over time, both her GP and family started noticing some changes in her behavior and her mood. She rarely left her home, which was very abnormal. When she was home, she would self-isolate in her room. She wasn't taking care of herself the way that she was previously. So she wasn't showering, grooming, doing herself up to get out of the house and leave the house the way that she was before. So this was a major change in this client's participation. So it appeared that there were some mental health things going on. So the WorkSafe case manager had referred her to OT services and counseling to address these things. In addition, she was also referred for a psychological assessment. And through the psychological assessment, she obtained a diagnosis of PTSD and major depressive disorder, both of which were accepted on her claim as well.
So where we start off first as OTs is with, of course, the OT assessment. So we're performing this to determine functional abilities and limitations, symptoms, triggers, the current routine, and pre-injury job demands. So in the case of Janice, we were able to identify her symptoms being poor sleep, non-restorative, so meaning that when she woke up in the morning, she didn't feel rested. She was having nightmares, panic attacks, and difficulties with concentration and focus. And then looking into the triggers or activities she was avoiding. So avoiding visiting family members in care homes. She was avoiding work, the workplace, coworkers, and even thoughts of return to work so as not to aggravate her symptoms. And then she was also avoiding using fans or anything that sounded like a fan, because as mentioned before, that was part of what caused the injury. So we get this information and then we determine that there's a mismatch between the current function and the job demands, and then this guides our intervention. So we need to address the mismatch.
Right, and continuing with OT assessment. So as you can see on the left of the slide here, These were the physical tolerances and symptoms of Janice at the time of the OT assessment, but we're not going to focus too much on the physical aspect of her recovery in this particular presentation. What I do want to draw your attention to is how occupational therapists are the only healthcare provider that assess and treat physical, cognitive, and mental health limitations. Not only that, but we also work with clients in the context where the disability occurred. So community OTs can work with the client in their home, in the community, and also workplace. So this is a huge advantage. I mean, where physios are generally limited to clinics and focusing on physical limitations, or healthcare provider, or sorry, not healthcare providers, but mental health providers like counselors or psychologists are generally focusing on the psychological factors. In clinics, OTs have the ability to see the client in various different contexts and also treat all the different aspects that may be impacting them as well.
So what do OTs do to help someone in this situation that we just described? So let's go through the OT best practices so that you can see what our intervention would look like. So first off, we start at the level of strategy training. So symptom management strategies provided by the OT in this particular case of Janice is mindfulness. So we taught her deep breathing, yoga, meditation, grounding as methods to manage her symptoms. We also addressed sleep hygiene, so providing sleep education. I think we all know sleep is very important, and if you've had a good sleep, everything feels better. Yeah, your concentration's better, your mood's better, your energy level's better. So often that's one of the first places that we'll target our intervention. And then pacing. So Britt is going to go through that in gross detail on the next slide. So I'll leave that to her. And then, once we've taught all of these strategies to our clients, then we can look at progressing activity. So activity prescription and functional activation. So setting SMART goals. So I'm sure most of you know SMART goals. So just to review, specific, measurable, attainable, realistic, and timely. And then once we've set goals and we've taught the client how to set appropriate goals, we look at exposure programming in the home and the community prior to return to work. Again, we're going to be going over that in some detail and what that means in the slides to follow. And then activity scheduling and routine. So that's another part of intervention that we use to help build a routine. Routine has been shown to help people with mental health move forward and progress their activities in the community. And then grading that activity in the home, in the community, in the workplace. So we're going to show you how we did that in the case of Janet. One last thing I want to add in this slide is for Janice in particular, we did refer her to the Driver's Assessment and Rehab Services Program. It's called DARS, program with WorkSafe BC, because she was exhibiting some difficulties with driving due to her reports of anxiety.
Right. So as Leah mentioned, one of the things that OTs can do is helping to structure return to activity. So we provide clients with education on how to safely and effectively increase their overall activity participation. So as you can see on this slide here, these are some graphs and some visuals that we actually use when we're providing clients with education and helping them to understand what pacing and grading activity means and what that strategy looks like. So as you can see on the top left, we have the wait until something. So this is an example of what we sometimes see with clients is they are avoiding any activities that increase their symptoms, whether those symptoms are physical, cognitive, mental health symptoms. So in Janice's case, she was avoiding fans, the sound of fans. We found that the sound of running water in the shower is actually very similar to a fan. So she was avoiding showering, avoiding all the things that she was doing previously because they were aggravating her symptoms and making her feel worse. Again, this is what we see with clients often. So what ends up happening is they're avoiding. They're waiting until they feel better. They're waiting until something changes. And what that looks like over the long term is that over time, they're decreasing their overall participation and activity, which is not what we want. Alternatively, we also see the crash and burn cycle with clients. So this is something that is almost as common as the wait until cycle. So we recognize that our clients have bad days where their symptoms are worse and more severe, and they can also have good days where their symptoms are less severe and they find that they can do more. So clients that fall into the crash and burn pattern tend to wait until their good days when they're feeling better than usual, and they'll try and catch up on all the things that they haven't been able to get done, or they'll overdo it and do what they were doing before, or just really do way too much activity, which ends up flaring up their symptoms. They might be down and out of commission for a few days afterwards, leading them to doing less activity. Then they'll feel good again after resting, so they'll do as much as they can. And it just kind of perpetuates that cycle. So as you can see from the graph too, over time, if they continue this crash and burn cycle, it's going to result in less activity, and not building up their activity tolerance. So what we teach is the best approach to return to activity, which is a gradual stepwise process. So we start by finding what a client's baseline is. So that is pretty much what they're able to do in a day, whether it's a good day or a bad day. We make sure that they're able to demonstrate this ability to maintain this level of activity on a consistent basis, whether that's for a week, whether that's for a month, whatever works best for the client or whatever we've decided. And once they've demonstrated that they can maintain this activity, that's when we up the activity level a bit and just continue on that pattern. And over time, it results in increased functioning, increased activity participation.
So return to work and exposure programming. There's 3 stages in this process. So we can start, as you can see, in the level of the home, then take it to the community, and then into the workplace. So based on our assessment results of the worker, we can start at any of these stages. There's no cookie cutter approach here. Each worker is an individual, and they will all be at different stages in their recovery when we meet them, and have different needs. And that is why the assessment process is important. And we can't just skip that. We can't just jump right into intervention. We need the assessment part. We can help a worker get ready to start a GRTW and then do a GRTW. That's what this process is. And Britt will go through how this was applied to the case of Janice in a bit more detail.
Yeah, so as Leah mentioned, the exposure program is always tailored to each client and depends on their level of disability and how their PTSD symptoms are manifesting in different settings. So we spend a lot of time developing and planning these exposure programs so they suit the client and are going to be beneficial to the client. We also work quite closely with mental health providers like counselors and psychologists that are generally already on the client's healthcare team before. So first, I guess let's start by explaining what graded exposure is. So in essence, it's gradually exposing a client to different situations and environments that increase their psychological stress. So over time, with repetitive exposures, they generally become better able to tolerate these triggers, and their overall mental health symptoms decrease. Of course, all clients are different and require different situations and exposures. They may be in different settings, those types of things. So again, like I said, the planning piece is huge, and the timing and frequency of these exposures is something that we work closely with to determine in conjunction with their treating healthcare professional, mental health care professional. So what we have up on the slide here are the examples of exposures that were used specifically in Janice's case. So you can recall that she was having difficulty showering because the sound of water running sounded like a fan, which increased her symptoms. So we started by having her listen to audio recordings of a fan. As she became more comfortable and desensitized to this, we progressed the duration of time that she was listening to it, eventually moving forward into sitting in her bathroom while the shower was running, exposing herself to that and getting used to that sound, adapting to that. Moving closer to the shower, so sitting on the edge of the tub while the shower was running until she was ready to actually get into the shower. And we set SMART goals as well around her showering more frequently. as well, and being able to do that independently. So once we'd addressed the issues in the home environment, that's when we moved on to the community. So as you can probably recall, Janice was avoiding leaving her house. She didn't feel comfortable in the community. So started by just doing neighborhood walks, leaving her house with her OT, and then progressing to visiting different stores where she may encounter a fan. So Walmart, Canadian Tire, those types of places. Throughout the process, we were also setting community goals. So when she wasn't seeing OT, she was still required to participate in these exposures, like doing walks and things that she was able to do on her own, and just making sure that we were keeping that frequency up of her exposing herself. And then we also wanted to make sure that she was returning to her community activities. So we had her, when she was ready to start, returning to those leisure activities like the dance class that she was going to on a weekly basis. Once we'd addressed the home and community aspects and she was functioning well in those areas, that's when we started moving on to and looking at work. So as Leah had mentioned in an earlier slide, the workplace, thinking of work, all of these things were triggers for her that would increase her symptoms of anxiety. So starting gradually, like we always do. So driving past the workplace was one thing that we started doing, probably for a week, couple of weeks of just driving past and seeing how her symptoms were manifesting and how she was able to tolerate that. Once she was able to feel more comfortable, we progressed to sitting in the work or in the parking lot of the workplace in her car. So not actually going into the workplace, but just being near it. And then continuing to work towards walking around the perimeter of the workplace. So getting out of the car, not going inside, but getting closer and closer to that workplace until eventually her symptoms had decreased enough so she was able to enter into the workplace.
The job site visit. So when clinically appropriate, the OT will complete a job site visit with the client and the employer representative present. So what is the purpose of the job site visit? So first off, it's to confirm the job demands so that we can get a better idea of what duties the worker is responsible for. And then we'll go into more detail on the next slide on that. And it's an opportunity to discuss the return to work option. So as an OT, we need to get a better idea of what modified duties are available. Can modified hours or modified shifts be available? If the worker was working a night shift during the gradual return to work plan, are they going to be working a day shift because there's more staff around? So that's the kind of information we need to gather in order to build an effective gradual return to work plan. And this job site visit is also a wonderful time to build rapport and co-develop a return to work plan. So you've got three heads around the table. You've got the worker, you've got the OT, and you've got the employer. So everyone's sitting around the table and discussing what this return to work plan could look like. And in this time, the employee or the injured worker, the client is there, and they now have some agency and they're being empowered to create a return to work plan that they're going to participate in. And they're the expert of their job. They know it better than anybody. And so they're the best person to ask those questions to and to be part of the process of building the return to work plan. And just in our experience, when a worker is part of that development process, the plan goes more smoothly. And I believe it's because they're empowered in the process. Next is just to determine the gradual return to work start date. So how soon can the worker start? And the worker wants to know that, the employer wants to know that. And then, of course, that helps us date the plan and move it forward.
Right, yeah. So bringing it back a little bit to the case study and also to touch on, again, like why do OTs go to the workplace? I mean, Leah has already touched on there's multiple reasons why: building rapport, empowering the clients. It also allows us to get a better understanding of the job demands, the physical, cognitive, and psychosocial aspects of and how the workplace environment may impact these things. I mean, sure, job demands for a care aide or any other professional, they could look the same on paper, but what an in-person visit allows is a better understanding of what is required at that specific job and that specific site. and what unique factors exist that we need to know about in order to successfully support a return to work and develop a return to or GRTW plan, gradual return to work plan. So for example, like equipment that's used at different sites, so the types of lifts, maybe the software, documentation and charting software, or even the layout of the building could vary from place to place. And these are things that we need to know. There's also, as Leah mentioned, maybe different GRTW parameters that employers use that we need to be aware of when developing these GRTW plans. So maybe a worker on a GRTW plan is always an extra worker or supernumerary, and that's an employee policy. So these are things that we need to know. The other thing that is helpful is that we can also set up and talk about job coaching during these visits as well. So job coaching would be an on-site session where the OT, myself or Leah, whatever OT, would end up going into the job site, usually while a worker is on a GRTW plan. So during one of their shifts, it'll be scheduled in. And this gives us a chance to help provide education, training, on how the worker is able to apply the strategies that were taught outside of the workplace to the workplace, and making them more successful in continuing the GRTW plan. So these are things that happen. There's weekly communication as well. Generally, when I have a worker on a GRTW plan, we'll decide a day and time that works for us to touch base, just to make sure on a weekly basis, just to make sure everything's going well. The job site coaching, of course. And then upon completion of the GRTW plan, sometimes we recommend it, sometimes it doesn't need to happen for the worker, but we generally see it's beneficial if we continue to monitor this worker after the GRTW plan is finished for a couple weeks, just to ensure return to work durability and that they're able to maintain their lives and their activities outside of work as well as at work.
Okay, so employer best practices. So what can you do as an employer to support your worker, your employee in returning to work and staying at work? So maintaining contact with the worker to show your concern and care without putting any return to work pressure on them. So what that could look like is a phone call or an email check-in, just hope you're doing okay, without, in that first 2-3 weeks or so, no, without asking the question, hey, when are you coming back to work? Because that puts pressure and creates anxiety on the worker. Secondly, addressing potential return to work barriers that may impact the worker's return to work. So an example I want to provide is, I think in healthcare, we're stretched. So there's a lot of short staffing and a lot of overworked people. And so when someone comes back on a gradual return to work plan and they're working modified hours, they're maybe taking a break every hour, maybe they're working with the lighter or easier residents or patients, that can create animosity in the workplace amongst coworkers who are already feeling stretched. And so for the coworkers to understand that this gradual return to work process is actually temporary and it's actually going to result in that other worker coming back to work more quickly, and they'll be more productive more quickly. Having that education and that knowledge could be helpful. And for them just to understand, hey, this person is going to take breaks more often. This person is going to work with the easier patients initially and then build up to that. And so it would create maybe more of a supportive environment for that employee returning to work. That feeling of support is so important, because if you're not feeling supported in the workplace, you're not going to want to show up. So providing that education is, I think, very important to the coworkers. Okay. So number 3, maintaining timely communication with the OT and the case manager to assist with a supportive return to work before, during, and after the GRTW. So when the OT calls to set up the job site visit, a timely response back to that OT is very helpful. The sooner we can get a person back to work, all the research shows, the more successful that person is going to be in their return to work. So that initial phone call and getting that job site visit set up as soon as possible is invaluable. And then during the GRTW, so if you as the employer are noticing that things aren't going the way you would hope they'd go, or there's problems that are coming up during the GRTW, you need to reach out as soon as possible so that we can address the issue in a timely manner. And then after the GRTW, if things start to kind of fall apart, we want to hear about that. Contact us, contact the case manager so that we can address the issue. Next, facilitating the GRTW recommendations are being followed. So, like Britt said, we do take a lot of time to make these plans. And we do gradual progressions in duties, gradual progressions in hours. And so if these aren't being followed, the client isn't going to progress, or the worker isn't going to progress. So if they're not getting the duties that they're supposed to be getting that particular week, or maybe they're getting too many hours. There might be that crash and burn that happens. Or if you're not giving them enough hours, they're not going to be able to build that activity tolerance to meet the goals of the next week of the gradual return to work plan. So it's really important to try to follow that plan as much as you're able to. And if you're not able to, things happen, contact us immediately so we can revise and rework that plan to support the worker. And then lastly, addressing concerns. So if there's worker concerns, for example, if a worker is saying to you, hey, this lift isn't working properly, or they're having an issue with a coworker, or they're experiencing some safety issues, addressing that right away with a worker is very helpful in their participation in return to work. And I just want to give an example of something that was said to me from a client just on Tuesday, so a couple of days ago. I was meeting her for coffee after a job site visit, and she expressed to me that after she was injured, her employer sent her a card and flowers and email and just check in once a week. And she said how, valued as an employee that made her feel, and how welcome and wanted in the workplace. And that she expressed to me, I'm so excited just to get back there. So I just thought, wow, like that really rang true for me and made me really think about the slide that we'd made like a month ago. So yeah, just wanted to share that with you.
Right. So like there are employer best practices, obviously there's worker best practices as well. Um, so as it's expected for the employer to allow the worker to follow or facilitate the worker to follow the GRTW plan recommendations, we want the worker to actually follow the recommendations as well. So generally our plans are very clear. We've got the hours, we've got the duties that they're expected to participate in that week. So we're expecting them to participate and do those duties. So it's important that they follow the recommendations because, as Leah said, if they're not following the grading of the duties or they don't have the opportunity to, it may not result in a successful graduated return or return to work. It's also important for the worker to follow the self-management strategies that was taught by the OT in the home and community setting to maintain a balance of activities outside of work. We really don't want all the progress that was made in the home and activity to fall apart when a client is in the process of returning to work, because that's generally not going to result in a successful or durable return either. So we want to make sure they're able to maintain things outside of work while they're progressing in their GRTW plan. Worker is self-advocate, so that's kind of speaking to what Leah has already touched on if for some reason, whatever the barrier may be, the worker isn't able to follow the GRTW plan duties or recommendations or hours, it's important that they speak up, and whether they communicate this to the employer or speak to the OT, it's important that they bring these things up and don't just kind of sweep it under the rug and move on to the next week. So related to that, obviously maintaining communication with the OT and attending sessions, rehab sessions outside of the GRTW hours, if that's what's required of the worker. So a lot of the time when a worker is on a GRTW plan, they'll continue to meet with maybe counseling or physio, whatever that might be. And it's important that they attend these sessions and these appointments while their GRTW plan is going on as well. Communicating with the employer and OT, again, like I mentioned a couple slides ago, generally we'll have a set day of the week where the worker will contact me and just let me know how the GRTW plan is going, if they have any concerns. But I mean, I always tell my clients and workers that if something comes up beforehand, maybe a couple days before our scheduled phone call, I want to know about it, whether they send me a text message or we schedule a phone call sooner. Because if something comes up, usually it's pretty easy to manage. If there's any issues or barriers, usually it's easy to manage if we find out about it sooner than later. So we don't want the worker to just not mention anything, sweep it under the rug, and then it to turn into or snowball into a way bigger issue than it needs to be. And when we address these things timely and in a timely manner and quickly, it's generally going to result in a more successful completion of the GRTW plan and a successful return to work. Lastly, we want to make sure like the worker is expected to follow the general workplace expectations, whatever pre-existing policies there may be, or policies around sick days, vacation, those kinds of things. They're expected to follow those in addition to the GRTW program as well.
Okay. So WorkSafe BC best practices. So what is WorkSafe BC's responsibility in this? So first off, timely communication with the worker, the employment, and treatment providers. So I know WorkSafe BC is working and developing processes to ensure timely communication, which is great. Payment of wage loss benefits to workers per eligibility. So getting paid on time is important, that, you know, especially in our economy, and not getting paid is going to result in stress. So it's their responsibility to make sure that wage loss gets to those workers in time. Referrals to the right provider at the right time. So, you know, if the client needs physio, or massage or whatever it is, it's their responsibility to ensure that those referrals are made and go through. And sometimes it's us as healthcare providers who are advising of those referrals, which I'll get onto in the next slide. Timely decisions and adjudication on the part of the case manager. And then ensuring the worker understands the limits of what WorkSafe BC can offer them. So they have to have a realistic understanding of what WorkSafe can do. I think in the past, retraining is something that happened more frequently, and it's, I would say, less common now. And workers need to understand, I think, what they're entitled to and where their claim is going to go. And that generally helps participation. And so it's up to WorkSafe to explain what to expect to the injured worker.
Great. So we're going to switch gears here a little bit for the remainder of the presentation. So we've taken you through a typical case of a worker who's on claim and the best practices associated with this. But what about workers who aren't on claim, or workers who are at work, but you notice they're struggling and could benefit from OT or employer involvement? Well, first, before we're able to address these issues or concerns, we need to know what a struggling worker looks like. So on the left side of this slide, we've brainstormed some red flags and some signs that a worker may be at risk, even though they are still at work. So increased sick days, whether they're paid or unpaid sick days, not completing job tasks or meeting productivity goals, whatever that may look like for the specific worker in their role. Maybe there's increased interpersonal conflicts at work between coworkers. That could be something that comes up, and reduced work quality as well is something that employers or managers may notice. I mean, of course, there are endless reasons or possible reasons to why these things may be coming up or why these things may be happening at work for these workers. So we've listed a couple that came top of mind. So there's obviously illness, injury that is not work related, some relationship difficulties. Maybe a worker is going through a divorce. Maybe there's some things going on at home that's really weighing on their mind and making it difficult for them to perform at work. So again, the list of possible reasons are endless, and we recognize that employers aren't able to solve every single problem. But I think what the best thing for an employer to do is to approach the situation with curiosity. I mean, if you're noticing these red flags, it's worth reaching out to that worker and investigating a little bit more, reaching out with care, concern, and showing that you're wanting to support them. In a non-judgmental way as well, just opening up that communication, maybe exploring what might be going on and what as an employer you have, what resources you can draw on in order to better support your worker and keeping them at work, even though they're struggling.
So what can OTs do to help workers at risk stay at work? So first off, assessing the mental health risk at the workplace. So in the previous slide, we discussed some red flags that come up. So we're looking for those things. And then trying to facilitate communication regarding those identified risks and issues with the appropriate people in the workplace. Um, and then once we've assessed and identified what those red flags are, we're going to try to provide strategies to address those. So strategies, examples of some might be assertive communication, stress management, sleep hygiene, energy conservation, ergonomics, pacing and breaks, whether they be physical, emotional, cognitive, mental breaks away from the work. So essentially what we're trying to do is we're trying to teach resiliency, right, through strategy use. And and like I said in a previous slide, OTs really look at work-life balance. So we're trying to support them to achieve work-life balance by having a balance of activity in the three areas that OT categorize activities. So there's the self-care, the productivity, and the leisure. So if we can teach these workers to have a balance between these three activities areas, they become healthier mentally, physically, emotionally. And when you're healthy in those areas, in addition to having the strategies, you're resilient. And so that's what we do, and that's what we can give to these workers to help them stay at work and be healthy at work. And then lastly, just directing them to resources that the employer may have to support them in the workplace as well.
Right. So this may be one of the most important slides that we actually take you through. So we have covered in detail kind of what best practices are for return to work, what OT does, a typical case of what a return to work looks like when an OT is involved, but how do you actually access OT? Is an important thing. In order to get things started, you need to know how to access us. So first surefire way is you can always ask your employee to discuss occupational therapy with their doctor. Through that discussion with their doctor can find out whether OT is something that would benefit them and hopefully make that referral as well. For clients who are on a WorkSafe claim and they might not be working with an OT at the time, you can always reach out to the case manager who's managing their claim. And this is the terminology that they understand and that you can use in order to influence an OT services referral. So OT services for gradual exposure, mental health treatment, and GRTW when appropriate. The case managers will recognize that and know kind of what you're talking about, and this will kind of prompt them to explore a referral to OT services. OT services through ICBC. So if a worker has been in a motor vehicle accident, you can always encourage, maybe they are back at work, maybe they're struggling at work. You can encourage an employee to talk to their adjuster or other healthcare providers who are on their healthcare team about accessing OT as well, kind of putting that idea in their mind. And it may result in a referral. There's also direct referral to OT through private healthcare plans. Different long-term disability benefits may also have OT services as part of their plan, and what's available to the worker. And finally, as an employer, you are able to hire OTs to work with your employee yourself as well. So that is always a possibility as well.
So, workers might not have access to OT, but that doesn't stop you from hiring an OT. So we at Community Therapists, we're a company that can help with return to work and injury prevention initiatives. So some of the services that we do offer to support workplace health is stay at work services for burnout and mental health. So we've already described that in previous slides. So identifying the flags and then addressing those, and teaching strategies and resiliency. GRTW. So we can make gradual return to work plans, as we had described before, to help a person progress back to their pre-injury hours and duties, or as close as possible to that. Disability case management. So what we do in case management is we create accountability for insurers. We are aware of all the programs that a worker could be referred to, and we can make suggestions for referral. We're in a good place to do that because we understand the system, and we also understand the worker as an occupational therapist. I want to give an example. I had a client, he had a concussion and he developed a speech difficulty as a result. And the case manager hadn't thought to refer him to speech language pathology. In fact, he didn't even know what it was. So I was able to make that recommendation, and the worker was able to access the service and was able to get back to work in Border Patrol, which, you need to be able to communicate properly in border control. So that was an important catch, I think. So we work really well in disability management is my point there. And then also we can liaise with the case manager and the client to make sure that they're getting access to timely care. So that's how we work in disability case management. Ergonomic assessments and musculoskeletal injury risk assessment. So sometimes WorkSafe requires an employer to do these, and they could be sent in order to have this assessment done. So our company can assist you in that regard. And we can write those reports and help you. Next off is physical demands analysis, but also cognitive demands analysis. So that's a service that we offer, whereby we go into the workplace and we assess a position. And it doesn't have to be injury specific, it's more global. So we're looking at the description of a particular position, the demands of that position and the tasks of that position. And the demands could be physical or cognitive, like I said. And then we prepare a document, and it's a document that you as the employer would have. And so if you're ever having to deal with any other healthcare providers who have questions about that particular job and the demands of that job, you could simply hand them that document, so that they could use that and run with it without having to go through every single little piece and think of every single little thing. We've already done that for you. Now you have that document in hand. So next is the driver's assessment and rehabilitation services that we also offer at Community Therapists. So this service can be funded by WorkSafe, ICBC, and Road Safety BC, and you don't have to have a claim to be eligible for the service. And I think I leave it to Salim now for questions.
Hi, thanks everyone for attending. My name is Salim Jen Mohammed. I'm the managing director and also an OT here. And I just wanted to invite any questions either now or in the future. My phone number, which is not there, is 604-566-8455. And so my role, among others, is to work with employers on figuring out their needs and designing services for them and providing information. And if we can't assist you, we can point you in the right direction often. And we haven't been monitoring the chat, so I think we'll just open it up for questions. And so if people could fire away, we'll see if we can assist you.
Stop sharing screen.
Oh yeah. All right, I'll just open up the chat. Okay. Don't see any questions. I'm not sure if Carissa is still on the line, but if there are questions, we're happy to take any questions right now.
Yeah, so if anyone has questions, please put them in the chat or the Q&A. And they'll be happy to answer them.
That's a good sign. So timely OT treatment for workers, I think what that means really is when the signs that an OT referral may be helpful is to actually have that referral occur. So whether it's a case manager or an insurance representative to make that referral, or it's a healthcare provider, or if it's you as an employer to say, hey, I know that this person is not, I've spoken with them, they're having challenges at home, they're having difficulties returning to work. So really timely means as soon as you notice these signs, symptoms, and problems, or you learn of them from the client directly, to ask questions of the insurer, encourage the client or the worker to speak with their doctor. So that's what we mean by timely. The next question here is, find a challenge with case managers not timely communicating with the employer when following up to make sure treatment is progressing. I'm going to turn that one over to Leah, and she's very diplomatic. She'll be able to answer it. Leah, you want to hop in there?
I don't know if I can be super diplomatic. Yeah, they're renowned for not calling back on time, but they have been in the process of developing strategies for that they've been put in. I think it was September that they put them in place. So myself, I've noticed more timely return calls, and I think it's something that they've been working on. But I think it's to my point about that disability case management piece. It's something that we can help with. We have strategies and routes to try to get to them a little bit more quickly. So again, yeah, I sympathize that it's been difficult for you. I know they're working on it, and I think we've all experienced it, and so they are trying to address it.
Leah, is there a strategy with leaving a message in a certain way so it'll get responded to?
Yeah, I mean, for us, and if I'm looking for more treatment time or looking for an answer to something, sometimes I'll leave a message and say, hey, I need approval to extend this gradual return to work plan, for example. If I don't hear from you in 3 business days, I'm going to assume that you're okay with me making that extension. And then that's on file. So if I don't hear back from them, I will make that extension, and it's documented that I've done that. And so then it becomes accepted.
As an employer, is there a way for employers to log a message that will get addressed or documented in text into the worker's file? I thought there was a way that they could do that more specifically than just leaving a voicemail. Is there a way that they call a general number and have it transcribed? No?
I'm not sure about that, but I see someone wrote I had a good experience with uploading a document to the portal.
Okay.
Then they get uploads to their file. Yeah, I could see how that could work.
So uploading a memo to the portal.
I think also when you call customer service at WorkSafe, it's at 604-231-8888 number, you can get put through to a customer service rep who will take your message. And yes, that message gets sent to the case manager, and I believe it flashes on their screen so that it can't be ignored.
That's what I was referring to.
Yeah,
Thank you, Leah.
yeah, no problem. Also calling the service coordinator of the case manager is sometimes a quicker route to the case manager. Yeah.
And with WorkSafe, they do each case manager coming into frame here, they do have many cases, and so I think we have to keep that in mind. Some of them have, I think I've heard 100 to 120 cases, and so it's like all areas of life and interacting with other professionals. I think persistence is the key. And, as much as we want to hear back from them more quickly, they have some challenges with their workload as well. So, we're all working together for the same goal to help our workers get back to work. And, but those are some strategies. Hopefully that helps. So it looks like we've got we've definitely have more time to answer any questions. I think we've officially got 6 more minutes. So fire away. And everyone who's thanking us for the presentation, you're more than welcome. And certainly, if you have any questions that you want to discuss a case, you're not sure if it would be right for occupational therapy, I invite you to send me an email or give me a call. There's no obligation. You can just simply ask, I've got a client or a worker with this situation. Do you think OT would be helpful? And my phone number again is 604-566-8455. And happy to help. And again, as I said, if we can't help, we can point you in another direction and make sure you get what you need to assist your worker. I'm just going to scroll through the chat. Let's see here. Okay. Well, we'll stay on the line for a few more minutes, and we thank everyone for taking time out of their day to learn a little bit about OT.